Welcome to Everything Neuropathy. My name is Dr. Karen May. Today we're going to cover a topic that so many people have asked about. We're going to talk about medications that are commonly prescribed for people who have neuropathy. I need you to be very aware that I am not a prescribing physician, and so I can offer zero guidance on the medications themselves, on dosaging. You must talk to your prescribing physician. I'm going to offer broad concepts so you can understand the categories of drugs that are out there and what the drug is commonly used for, and then how it works for someone who has neuropathy for pain. So please, 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 this does not constitute medical advice, but you can talk to your physician about it. All right, let's jump in. I'm going to be honest with you. I have lots of different notes because I'm not a prescribing physician. I'm aware of the medications, but I may not pronounce them all correctly. And I think like you, I think all of us struggle to pronounce them at times too. So here we go. Let's dive in. What I realized in all of the research, and I was literally diving in the research, is there's really three broad categories of medications, and four because one's broken down a little bit. So when we're dealing with neuropathy, doctors usually prescribe medication to control pain, and that's the extent of what the medication is used for. And maybe you've been that person who has gone through multiple different medications. So the three big categories are antidepressants. Then there's also just a lidocaine pill, and then there's anti-epileptic drugs that are also used, and the research is shown to help. And breaking that one down, there's also anticonvulsant medications. That's a little bit different than the anti-epileptic drugs. So when we're looking at the antidepressants, this is like duloxetine, think Cymbalta, nortriptyline, antitryptyline. These are what they're designed to do is work with the neurotransmitters in the brain. That's literally what it's designed to. So because if they can work with the neurotransmitters in the brain, then the drug is working on what's called the central nervous system. So that's your brain and your spinal cord. And it inhibits or stops the signal from coming up from that painful stimuli that you're getting in your extremities. It stops your brain from recognizing it. That's the whole goal of it. And there's some of the research was saying it's beneficial. Some was saying that it's not. And when they're looking at studies. So I think when we're dealing with neuropathy pain, it's very difficult because you just want relief. So this is one category that doctors will prescribe. The next one is more of a lidocaine. It's mexiletine. Mexiletine is, I think, how it's prescribed, but this one's oral lidocaine, and it can sometimes be effective. It can sometimes not, but when we're looking at it, it's literally designed to reduce the pain signals too from that central nervous system. But what it does is it also bonds to the peripheral nerves, so the feeling of pain is also diminished. It doesn't repair the nerves, it kind of just dumbs the nerve down, so that way it doesn't perceive it as being painful. Then we have the anti-epileptic. These are the more common ones, the pregabalin or the gabapentin. So think Lyrica, gabapentin, which that's Gracilis, Neurontin, and there's a couple other ones too, or that are more brand name ones. But these are used to relieve pain caused by the damaged nerves. Same thing, it's to relieve pain. So I'm reading this, it says anti-seizure medications appear to interfere with the overactive transmission of the pain signals sent from the damaged nerves, or any ones that are like overly sensitized. So common side effects of those: drowsiness, dizziness, fatigue, muscle tremor, and some less common side effects are visual disturbances, indigestion, weight gain, leg swelling, memory loss, mood changes, hallucination, and rash. Obviously, if you're having any of those, you better be talking to your doctor. But those are, and they start at different levels, and then they go up. And if you've tried one, you've probably tried them all, trying to find one that works for you. And then the other kind of subcategory is anticonvulsants. And this one is carbamazepine, and it's also carbamazepine, if I'm pronouncing it correctly, also helps to treat bipolar disorder. And the same thing, it decreases those nerve impulses. So that one, side effects looking at liver damage, nausea, vomiting, double vision, loss of coordination, drowsiness, headache. So those are the broad categories as to what you may have been prescribed. When we get people in our office, and having dealt with neuropathy myself, I can tell you that you'll do whatever it takes in order to get relief. And so I'm not opposed to medication, but understand that Lyrica right now is actually the DEA, the Drug Enforcement Administration, has classified it as a controlled substance. So but gabapentin, even though it's not yet linked as a controlled substance, I got this from an addiction website that they have been shown to cause addiction in people. So yes, there's a room for use and abuse with using Lyrica and gabapentin, which is another reason why you can't just go off of it cold turkey. So you got to be aware that these are serious drugs, that if they help you, fabulous. But understand that medications are going to do one thing. They're going to depress your central nervous system or block pain signals. They're not going to actually physically rebuild and re-educate the nerves. So you have to make a choice. And I've done other videos too, and about why doctors tell you your nerves can't heal, because I hear that all the time. Those doctors told me they can't heal. Go watch that video. But nerves do heal at 1 millimeter a day under ideal healthy conditions. And that's the part that you're probably missing, is if you have other things going on besides neuropathy, other chronic disorders that require other medications, you're not under ideal healthy conditions. So of course your body is going to be heightened to pain as well, not just from neuropathy. So understand medications, they have their place, they have their purpose for certain. But if you don't want to become dependent on those medications, or that medication level no longer works, so your doctor has to just keep prescribing more and more and more, or maybe you can't take the medications, you've had side effects to the medications, and those aren't an option for you, please know, go on to our other Everything Neuropathy. You can start by using food as medicine. Look at the information that we've talked about improving microcirculation to get better blood flow to those nerves. But really, you can also just sign up for our free webinar. It's educational, and really I'm going to cover exactly how neuropathy is attacking your body, because most people don't even understand what physically is going on, and I'm a visual person, so I like to show that. But then it's going to talk about the traditional approaches, which aren't super promising, but then I will also describe what I put together for myself and helping over 350 people, and that's our Neuropathy Relief Bootcamp. If it's helped me and everybody else that we've put through our program, and so understand that it takes effort. It's not as easy as just taking a pill, but if you're willing to put some time and effort into it, it starts by just watching this webinar. So don't just settle for another drug. Find other options that you can work with to help yourself. Only you can do it. Have a blessed rest of your day.